Welcome back. Let's discuss what our goals are for today. We're about to walk you through how we're going to address the underlying causes of your joint pain, how we'll rebuild and restore your joint function, and how to maintain results long term. During your previous visit, we talked about your joint pain, how it's affecting your life, and what your health goals are. Since you've made it to this point in our process, the good news is we can help you. Today we are going to discuss your condition and review your care plan to get you the results you're looking for. At this point, our practitioner has helped you understand the possibility of getting your life back, in addition to the implications if you don't take action with this chronic condition. What does it take to restore normal joint function? You probably think more like a joint health expert than you might think. For example, what would you do if you saw this plant and you wanted to help it heal? Well, you'd probably give it sunlight, water, nutrients, maybe clean up the soil or remove any weeds growing around it. Guess what? You're exactly right in your thinking. Every living organism needs specific conditions to be healthy, and this is exactly what we're going to be doing to address your joint pain. Your joints need a very similar approach to this plant to stay healthy. So now let's take a look at this joint diagram. The image of the joint on the left is a normal, healthy joint. The bones, cartilage, ligaments, and surrounding tissue are nice and healthy. The space in between the joint is filled with a special fluid called synovial fluid that acts as a lubricant for the joint, provides cushioning and support, and supplies the joint with the nutrients that it needs to function properly. As you can see, the picture in the middle has a different look to it. It shows some signs of damage. There is not the same healthy cartilage and spacing in between the bones. This is where symptoms of joint pain might start to appear. Now, most people really don't start to have symptoms until the end of this degenerative process. So if you've had symptoms for some time already, then we have to look at the last image on this chart. The bones, cartilage, and surrounding tissue are damaged and inflamed. You can see that there's very little space left in this joint, and most doctors would call this bone on bone. This is a dangerous level of joint damage, and not where you want to be. So if the joint to the left is healthy because it's receiving the right nutrients, then wouldn't it make sense that we would want to supply the damaged joint on the right with the same proper nutrients? It needs to not only survive, but begin to heal and regenerate. Well, this is exactly what we're going to be doing for your condition. We can never get true healing with the drug, surgery, and cortisone injection approach. Those therapies only mask the problem and allow it to get worse. By contrast, we're going to be treating the underlying causes of your condition and giving your body exactly what it needs to heal itself. We restore joint function and health from the inside out. We take a comprehensive approach to treating your joint pain, and we see the best outcomes for our patients as a result of addressing the body as a whole. A critical and unique part of our approach involves a series of comprehensive treatments that we have developed to put the body back into an optimal position to heal. Your body knows exactly how to heal itself. Sometimes it just needs a little help. Let me give you an analogy. If you were to break your arm and needed to get a cast, does the cast heal your arm, or does your body do the healing? Of course, your body is what does the healing. The cast simply holds the broken bones in place while your body repairs itself. So let's dig in. Joint degeneration is a condition that requires treatment for all damaged areas. Fortunately, we have developed a 4-part comprehensive therapy regimen that has shown great results for our patients. We're going to be focusing on 4 components to restore your joint function. First, we need to provide the joint with the necessary lubrication and cushioning. We do this by supplying the joint with substances that are found naturally in your body. It's kind of like getting an oil change for your joints, which relieves pain by reducing the friction and inflammation that causes pain. Next, we need to stabilize and strengthen the joint. We do this by supporting and retraining the muscles and ligaments that keep your joint intact. We also focus on a specific rehab protocol to strengthen the muscles and ligaments that surround the joint. Not only does this help reduce pain, it limits further damage to the joint while your body is healing. Finally, we provide your body with growth factors and regenerative cells that work to fix the wear and tear in your joints. Unlike traditional therapies, which just mask symptoms, regenerative medicine works directly inside your joint to repair damaged cartilage, bone, muscles, and ligaments. The first FDA-approved therapy we use is viscosupplementation, which is a gel-like substance that contains an active ingredient that is naturally present throughout the body. In joints, it has several functions. This viscous fluid provides lubrication and also acts as a shock absorber within the joint. Viscosupplementation helps in the growth and development of cartilage and bone by promoting the growth of new cells and tissue. Also, viscosupplementation plays an important role in reducing inflammation and pain caused by osteoarthritis, so you can get back to your normal activities with less pain and restrictions and more confidence. Next, we look at bracing the damaged joint. Arthritis knee braces are ideal for relieving osteoarthritis knee pain, as well as providing stability while walking to encourage healthy mobility while you're healing. Osteoarthritis knee braces are different than the braces you find at the drugstore and require a doctor's prescription. Our doctors may prescribe what is called an unloader brace. These braces have a special hinge that relieves pressure on the damaged area in your knee. Our patients find that using the brace while doing chores or going for walks not only makes the activity more enjoyable, but they report less pain after activity. So what about rehab? The Arthritis Foundation states that exercise may be the most effective way to treat osteoarthritis without surgery, while the American Academy of Orthopedic Surgeons note that strong and flexible muscles can keep knees healthy and prevent injury. Strong muscles in the legs can help provide support for the knees. This support may alleviate pressure and strain on these joints, which can relieve pain and help you be more active. Finally, we use one of our most powerful tools, regenerative therapy. Regenerative therapy acts like a stem cell magnet. Stem cells are the basic cell template, or building block, of every single cell, tissue, and organ in your body. In fact, every cell in your body was at one point a stem cell. Your stem cells have the ability to generate new cells, including muscle, bone, cartilage, and even new nerve cells. You currently have stem cells in your body. This is the primary way your body heals and regenerates, like we mentioned. However, sometimes, for a variety of reasons, your body needs additional help. This is where regenerative therapy comes in by targeting specific areas in your body and activating the joint's ability to heal itself. When combined with the first 3 therapies we discussed, you have a powerful and comprehensive approach to knee pain. Do you see how this is different than just masking the pain with medication and cortisone injections? Through this multi-pronged approach, you'll get optimal results. You're going to be well on your way down a path to health, improved function, and independence. All of these services are equally important throughout the time that you'll be with us. Your practitioner has the best plan of action to address the underlying causes of your joint pain, and not just cover up the symptoms. We'd like you to hear from one of our patients after going through the Knee Restore program.
So I've been struggling with knee pain for about 10 to 15 years. At times it felt like somebody had a needle or an ice pick sticking it into my joint, and it was both knees. It was debilitating, but I tried to struggle through it as best I could. Yeah. To me, the most frustrating part was going up and down stairs. I couldn't do it. I couldn't do things outdoors because I couldn't walk. Yeah, my biggest fear was I couldn't do the things that I really liked to do. If nothing changed, I wouldn't be able to do anything. I would just be sitting in a chair forever. It made me feel pretty worthless. I just couldn't do anything. When I first heard about the program, I thought if this works, it'd be great, that I can continue. I was a little skeptical, but I figured I had nothing to lose. The pain went away in my right knee within a couple of days. My left knee took about 2 weeks. I could walk. I started to notice that I could walk. It didn't hurt. So, pretty amazing. It made me feel great. That's about all I can say about it. Just amazing. I can do things that I can do things now that I haven't felt comfortable doing. I can go out and walk and not worry about whether I'm going to make it back. I feel very, very good about the future. People dealing with knee pain, it is well worth having done. I mean, I would not hesitate to do it again. It's made a big difference in my life. I do not like surgery. It is a last resort. I've talked to too many people that have had knee surgeries done, and they're always worse off than they started. The fact that I didn't have to do surgery was the greatest thing going. Compared to before the program, I'm a lot more active. I get out and do things. I walk again. I go hunting. I go fishing. I do things I haven't done for a long time. My name is Jim Thompson. I'm really looking forward to being able to go outdoors, do the fishing and the hunting and time with my family. And just looking forward to everything.
At this point, I'd like to ask you to start thinking about what your motivations are for doing this program. Why is it that you want to get better? Is it that you want to have an easier time sleeping at night? Maybe you don't want to lose your freedoms of life, like going on walks or spending time with family, friends, or loved ones. Or maybe it's the fear of health complications like disability. Or maybe you're like so many other people. You want to simply get off the various medications that you're taking day in and day out. Everyone has different motivations, but it's important for us to understand your motivations because your motivations become our motivations. Our team will be with you shortly to review your doctor's recommendations and will cover any questions that you may have. Thank you for putting your trust in us with your health.